Alles beginnt mit einer Frage, mit dem Wunsch, ein Pferd wirklich zu verstehen. Aus genau diesen Gedanken ist der PKN-Podcast entstanden. Ein Podcast für alle, die Verantwortung übernehmen und bereit sind, genauer hinzuschauen. Hier kommen Tierärzte, Spezialisten, Pferdebesitzer zusammen, auf Augenhöhe. Geleitet von wissenschaftlicher Expertise, getragen von Neugier und Respekt vor dem Pferd. Mit jeder Episode öffnen wir die Türen der Klinik ein Stück weiter. Wir teilen Wissen aus Forschung und Praxis und machen Pferdemedizin verständlich, relevant und lebendig. Das ist der PKN Podcast. Schön, dass du hier bist. Learn more to care better. Our guest today is Dr. Kurt Selberg, a well-renowned specialist in equine diagnostic imaging. Kurt's deep connection to horses started long before his clinical training. He grew up on a family-owned quarter-horse ranch in North Idaho, an early foundation that clearly shaped his career. He began his formal path at Washington State University, where he earned his doctorate in veterinary medicine, followed by an intensive sports medicine internship in Virginia. From there, he moved to Colorado State University to specialize in diagnostic imaging. Today, Kurt is a board-certified radiologist and a diplomate of the American College of Veterinary Radiologists, titles that mark him as an elite expert in reading the complex scans of the equine body. In fact, he was a founding member of the specific subspecialty for equine diagnostic imaging. After a stint as an assistant professor of the University of Georgia, Kurt returned to Colorado State in 2016, where he now focuses on musculoskeletal imaging. Beyond the clinic, you'll find him lecturing at the International Society of Equine Locomotor Pathology, also known as ICELP, or working as an FEI treating veterinarian. He served as the on-site imaging consultant for the 2018 World Equestrian Games and the 2020 Tokyo Olympics. We are incredibly lucky to have him here to talk about protecting and supporting the equine athlete. This is part 1 of 2. We hope you really enjoy it.
Welcome to the PKN podcast. Today's episode is a little different. Before we dive into medicine, diagnostics, and clinical expertise in future episodes, we want to start with the person behind the profession. Our guest today is Dr. Kurt Selberg, a friend, a veterinarian who is working with many horse owners trust deeply, often at some of the most critical moments in their horses' lives. But like everyone, Dr. Selberg path didn't begin in the clinic. Today we want to talk about how the path started, the choices, doubts, and defining moments that shaped it, and what still drives him today. Hi, Kurt.
Hello. Thank you for having me on.
Yeah, it's a great pleasure. Thanks for being willing to talk with us. For the beginning, Kurt, let's go back to the very beginning. Before you were Dr. Selberg, before veterinary school, before the clinic, what was your world like growing up?
To be honest, like every other kid, I think I was outside playing all the time. I was out finding things to do, things to get in trouble. I think I was always a little bit of a loner at times. I could take care of myself and preoccupy myself with many things out in the playground. My family life though was pretty good. My parents were divorced when I was early, so I split time between them, and they were two different worlds a bit. One was very, very, very animal focused, and the other one was less animal focused. But my dad is a horseshoeer, and my stepmom is a horse trainer, and then on the other side, my mom is an educator, and she has her PhD in education, and my stepdad he was a principal for many years, and then moved into politics and was the mayor of our town. Was in the state senator. So we had two very different kind of lives. But either way, it was a good childhood growing up and a lot of diverse experience to go through.
So animals and in particular horses were already in your early life part of your life and of your experience.
Yeah, and absolutely. There's definitely animals that shape how you look out at things, and in particular like dogs, cats, things like that. But horses also definitely shaped how I kind of view the world. And I think my happiness has always been kind of tied around animals. And I just enjoy being around them. I like the feeling of the companionship. And they don't necessarily have to be snuggly, but there's something that brings joy to me. And I don't know if that's exactly how I got into veterinary medicine. I think it probably is a little bit, but for sure happiness has been tied around horses and dogs and cats.
And what was the moment where you first thought this would be a potential path for you to become a veterinarian?
I think.
Or was it much later?
No, it was early. I think I thought about being a veterinarian for sure, especially riding around with my dad, going to shoe horses, and meeting the veterinarians along the way, and having horses and veterinarians, and how the veterinarian was kind of welcomed onto the farm as almost like a family member in many instances, as this kind of friend / professional that was there to help out and make things better with the things that were sick and brought me happiness. And I think later, as I went through college, I found other interests. One of those was, I worked in a physiology lab, and this my major the guy I worked for, Dr. McGuire, he was an instrument in my education for sure, and he sat me down and was like, "What are you doing afterwards?" And I go, "Honestly, I thought about going to vet school, but I don't know that I really want to do that now. I'm thinking about going and getting an advanced degree." So my education took me on a different path, and I was getting a master's degree in molecular and cell biology and nutritional physiology. So I had gone down a different path for a little bit of time, and as I'm thinking about that path, I didn't really want to sit and write grants to make my life, because I was going to go on and get a PhD in that, and I didn't really want to write grants and do a bunch of research. I wanted to do something a little bit different, I think, after that experience. And so that's kind of when I turned back to veterinary medicine. But I wouldn't change that path that I did for anything. I actually really enjoyed it. I had a really great time experience. I moved to a different part of the country. So I grew up in North Idaho, near the Canadian border. The path that took me down to my master's degree, I went down to University of Florida. And that was a different experience, and I think I needed that experience to kind of grow.
Sounds quite interesting. Looking back now, is there anything from your childhood or earlier years that makes more sense in hindsight?
As in like being a veterinarian, or being just what I do in life?
Both.
Yeah.
Both. And for your decisions?
Yeah, sometimes I don't know. I don't know always why the decision I made, why I did it at times. It seems it's worked out really well for me, but I sometimes think I have like the patron saint of ding dong sitting on my shoulder that whispers, "Make this decision, it'll go well for you." And it has gone really well for me, and I think the biggest thing though is the perseverance, like to go through and make sure that your happiness, like the overall happiness. Do things make sense? Not always to me, but I have to trust in at least my process, whatever that might be, and it's led me down a really cool path thus far.
So veterinary medicine is not always an easy profession,
Sure.
Emotionally, physically, or intellectually. Do you remember the moment you truly committed to this path?
I think when I was accepted into vet school, I was really on the path, and I know that seems like it's a silly thing, but once I got to vet school and I worked throughout vet school. I worked in clinical sciences and education, and once I got to be into those kind of areas, especially watching other veterinarians work on these education processes with continuing education through the university and then being on the clinic floor, that's when I really committed and knew what I wanted to do. And we'll talk about like how my path, I guess, I wasn't always sure that I was going to be an imaging specialist. I actually really liked surgery quite a bit. And I remember one...
Nearly everybody does at the beginning. It's famous, huh?
Yeah. And I remember I think I was in it was a colic that night, and I had to go take a test the next morning, and they're fishing the guts out of the abdomen, and I was sitting there and I was like, you know what? I'm not sure that I really enjoy abdomens at all. and so I was like, I'm not sure that's the way it was going to go. And at the time, the sports medicine college was just a starting kind of scenario, and I really was interested in that kind of setup, like the orthopedics and the imaging kind of side of it, but that didn't exist in terms of a specialist at the time that I was going through. It wasn't until much later that came around, and for whatever reason, I kind of got in really well with the imaging faculty as well as the surgery faculty, as I was a technician for kind of both of them, and both groups asked what I was doing in the end, and obviously imaging won out in what I was going to do, and I liked the puzzle of putting everything together. And some of the things I do miss are like seeing horses every day. Like I see horses every day, but some of the more in-depth kind of workup of lamenesses and palpation and watching the horse go all the time, I don't get to see all of that as much as I would like to. So I try to put myself out and watch the lameness go for a little bit, but sometimes I miss that portion of it being a radiologist.
What is surprising you the most when you were actually in it? What was the biggest change in your perspective and perception when you started your way?
To go into veterinary medicine, or to go into radiology specifically?
First was veterinary medicine, and then the next step to go to radiology in particular.
Yeah, reflecting back now, I was always in awe of all of the knowledge that all of my professors had, and seemed like they knew all the answers to what was happening. And I was like, man, I really want to be that later. I want to know as much as they do. I want to have that experience going through. And now looking back and where I'm at versus where I look back and I'm like, oh, these guys didn't have all the answers really. They were very educated and had really good thoughts, but they didn't always have the answers. And knowing that on the other side, it would have probably made a little bit different of an experience, but at the time it was actually really kind of cool to think that how much they knew, and I wanted to be that. And that was probably one of the experiences that led me in to be a specialist, was these guys that were so smart and so down to earth, but could get everything done and answer these questions in meaningful manners. It meant a lot to me. On the other side, you realize that they didn't have all the answers, but they were pretty smart people, and you learn the thinking process.
If you could sit down with your younger self at the stage, what would you warn him about, and what would you reassure him about?
Yeah, if I sat down for sure with myself, there's a couple of experiences that I think I should have taken more advantage of growing up, and just knowing where I am now. And so my dad is a horseshoer. I traveled around with him and helped him out shoeing horses. I probably would have taken a lot more time in shoeing horses to do it. I do remember many times people would always ask if I was going to be a horseshoer when I grew up, and I was like, probably not. And one day I was out with my dad. I was shaping a shoe for him to put on the horse, and he was over there screwing around with this horse for a while, and then came back, and I think I was in college at the time. My dad goes, "Son, I don't really care what you do with your life as long as your head is above your ass." And that kind of solidified it for me. And I was doing blocks out on the fields, and my head was below my ass, and there was this epiphany about 6 months into being a new veterinarian. I'm like, I don't think I did it. I don't think I did what my dad told me to do. But if I went back,
but you can change the perspective.
Yes.
If you're your size and my size, so I'm leveling this a little better.
yes, for sure. But I I would tell my younger self to, when things come up and it doesn't seem like you have enough time, or you don't have seemingly the resources to do it, find ways to do it, because you can miss out on experiences and you can miss out on friendships and times that you would absolutely have solidified yourself as this solid group of central friends that kind of keep you safe from yourself and safe from the outside world, and somebody to lean on quite a bit. And I would probably go back and tell myself, I don't think that I missed a lot of those experiences, but those little experiences that I maybe did miss, I think could mean a lot more to me. And so I would tell myself to make sure to just take it all in. There's so many good things that can happen if you just let it.
So appreciation of meaningful, worthful social contact.
Yeah. My group of friends that I have are very, very close to me. Very, very, very. We're all loyal to each other. We're all very, very serious about the friendship kind of thing. But we can have a good time. But that means a lot to me, to be able to call up on somebody and just be like, hey man, just BS for a while and let the world kind of go away and just have this conversation with a friend, and no judgment on the other side or from me that happens the other way, and kind of go through it. But friendship definitely means a lot. I don't have a ton of friends. I have a lot of really good acquaintances, and then I have this really tight-knit group of friends that really mean a lot to me.
So we're going a little back to your specialty, as you are a well-known, one of the best in the world for equine radiology. Most veterinarians don't start out knowing exactly what they will end up. How did you find your way into your specific field of work?
Yeah, there was a couple of things that went along the way, and that was I had said that I worked for both radiology and surgery in vet school, and that was actually one of the things that kind of shaped my way. And when I was sitting down with these radiologists that I thought were amazing people, not just veterinarians, but amazing people, they're like, you'll figure it out, and whatever decision you make, and this was from the radiologist, whatever decision you make will be the right one. So wherever it is, you do it. And I was like, that's interesting advice. It's just telling you to trust in yourself. And I think that was really kind of led me down the path of radiology. And then when I got to my radiology residency, there was some absolutely phenomenal people that I got to train under. And one of those guys is Dr. Dick Park, and he's just a master at looking plain film radiology. He was one of the first people that did MRIs on horses. And this guy is such a kind, amazing person. I was like, that really makes me want to be that guy and follow him. And I think among the people that trained me, he really put me down into that path, knowing that I've been already in a residency, but that guy actually solidified, I want to be that person.
So the fascination was also related to this kind of person.
Yeah.
And not necessarily only to radiology.
Correct. Yeah, that person.
So if he would be a gynecologist, or
I probably would have gone a different route for that. But yeah, for sure, it's just the way he kind of put things into perspective with radiology and how radiology could be a benefit to the masses. And so it's the guy, but it was also the topic. And along those same lines, I've had many mentors along the way. Whether big or small, and the other one that kind of came and really solidified me into imaging was Dr. Kent Allen, and he to this day is one of my best friends. He's a mentor, a father figure. He really has also solidified how I want to go through my life and what I want to put forward as well. And so I think that is the other thing I probably would go back and tell my younger self, is that mentors can be small, they can be peers, they can be anything, but make sure you just take it all in for mentorship, because a lot of people have really amazing ideas, and if you can kind of channel into that kind of stuff, it is really helpful for mentorship. And I think my younger self, I don't know that I was always as patient as I probably should have been, and not as gracious, and I think I'd go back and tell myself the same thing, to be a bit more patient, be gracious. like these mentors are that helped me along the way.
So from the outside, people often see veterinary medicine as very technical,
Yeah.
but from inside, it's also deeply emotional, don't you think?
Absolutely. Going back, as my happiness has been tied to animals, and it's when animals are suffering, or even the owners are suffering because they're animals, man, it really puts an emotional drain on you. I think it absolutely is an emotional profession, and you try your best to separate yourself from that, but you also know exactly how these people are feeling because you've probably experienced that same thing in life, and it's tough not to have that connection with the people that are struggling at a time of need, and something that could be potentially life and death, or even just the future of the patient. And I don't know. I think the profession itself is absolutely an emotional challenge, and you have to really be cognizant of that.
So what part of your job is affecting you the most when you were starting out?
Oh man, the self-confidence, I think, was probably one of the biggest things. Outwardly you want to portray that you know what you're doing and you're competent at your job, and early in life I think I was competent, but I just had a huge experience gap, and that probably that inner turmoil of self-doubt of what did you make the right decision, and thinking about putting the patient first, not just doing your job to do your job, but putting the patient first. Did I do the right thing by that patient?
It's very interesting. As more as experience you gain in your profession, as easier this question is to ask, and you are quite happy to do this.
Yes.
In the beginning it's struggling.
Yes.
It's not very comfortable, but with the time it is one of the most relevant questions any day to ask for
Absolutely.
any kind of case.
Yeah.
Were there moments that you nearly broke up, or maybe you questioned your choice?
I don't think there's any moment that I would have stopped to not be a veterinarian, or question my choice. Once I got to that point and I was doing my stuff, I really I knew I was in the right profession. I knew that I was in the right place. It felt good and felt natural to work through these things, and I don't think that I would change what I did. I think everything worked out the way it should.
So meaning the experience that shaped the way to work with horses and with owners, like having influence on your style of work today also.
Yeah, absolutely. And the people, they talk about horse people and people that have horses, like sometimes people that have horses and horse people are a bit kind of, I would say, crazy at times, but it's a crazy that I know because I am a horse owner, and I grew up around horses, riding them, and we get a little bit crazy because we like the animals so much and we get focused on it. But
it's like a virus.
Yes, it absolutely is. Yeah, it's a sickness, if you will. But it's something that I understood, and I was very, very comfortable with about how that kind of stuff. And I think that was also pretty helpful in moving into the profession, because not only you can talk to the people about their animals at a medical, but you can also talk to the side about their competition or what they do with the horse, and how, like, all those kind of things to break in to understand the horse a little bit better and be better at your job, I think.
So every veterinarian develops a philosophy over the time, often shaped by mistakes and learnings and experience. What would you say are the core values that guide your work today?
Yeah, again, putting the patient first above anything that I kind of, my own pride, my own whatever. I putting the patient first and being comfortable enough to say, I just don't know. I'm going to have to ask yet another person to get back to you about these things. And so I think ultimately, as I move through, I don't know, veterinary medicine, the being able to admit when you're wrong, or admit you don't know, or understand that there's more complexity to these things, and be forthcoming with owners and colleagues is paramount to success in this thing.
So like we were talking about the other day about Seneca, you know what you don't know.
Yeah, exactly.
To realize and
Yeah.
to have a network like ISAP, for instance,
Yeah,
to ask other people about experience in special cases.
absolutely.
Has your definition of good medicine changed over the years?
Oh yeah, for sure. With the time, there's when I first started, there were therapies or treatments that were done to horses, and it seemed like the best thing to do at the time. And then later, as you start to gain more information, you definitely have changed those treatment options, and that's a bit of the way science works, right? You do your best with the knowledge you have at the time, based on literature, and then that evolves over time of a better understanding. When you get more numbers, when you get longer term follow-up, all those things kind of change a little bit. And so for sure, my idea of quality of medicine has definitely changed over time, and what needs to be done, what can be done, and what is in the realm of probably a possibility, but probably not practical.
I mean, it wouldn't be serious if we wouldn't adapt our perspective of
Yeah, absolutely.
and position of good medicine. No?
Yeah, for sure.
We are gaining so much more knowledge, even in veterinary medicine, so we have to adapt.
Yeah.
How do you balance medical possibilities with the reality of the horse life and well-being?
Yeah, that one is probably one of the more difficult ones, because there's so many things that you can do, but are you actually going to do something for the horse? There was this saying that I heard once. This famous oncologic surgeon, he's like, there's something we can do to the animal, but we can't do for the animal, right? So it's just we're trying to palliative whatever, but in the end result, it's not going to do very well. And so I think that phrase has stuck with me for a bit, is being practical about the treatment and understanding when enough is enough, or when we can't do any more and we have to live with what we have.
I like to name it medical smartness.
Yes.
Combined with empathy for the patient. Huh?
Yeah, absolutely. There was that particular point was really illustrated to me by my first dog, which is he's a Buddy, which is a 14-year-old dog when he passed, but he'd gotten cutaneous lymphoma, and we treated the cutaneous lymphoma with lamustine, which is a therapy to kill those cells, and he responded very well, but he did go into a septic shock, and then later, through an error within the pharmacy, they gave him 4 times the dose of lamustine, and it completely knocked out his bone marrow. So he wasn't producing blood cells, he wasn't producing platelets, he wasn't doing anything. And he was in ICU for some time, and we did everything heroic that you could do for this dog, and he just meant a lot. He was a dog that kind of took me through many life changes and adversity, and so as we go through this thing, I couldn't let go. I couldn't let go of the dog, and I should have been better about that, just being a trained individual. And that was one of the things, like, we were doing something to the dog, but we're not doing something for the dog. And that one really has been solidified in me, as like, we have to do something, but sometimes you have to understand when enough is enough. And I wish that I had different choices at that.
I mean, it's quite interesting and obvious to see that behind a professor from a university with an enormous knowledge and a theoretical background, you are also a person that is taking care for his own animals. So
yeah.
We are coming back to the theory of the disease with horses. It's related to any kind of animal, whatever it is.
Yeah.
What do you think horse owners most misunderstand about veterinarians?
Sometimes I think they don't understand that we also have lives outside of veterinary medicine. But
Really?
but that, they talk about work-life balance, and I think that's shenanigans, really, to be fair. I think I was told once by a veterinarian, Richard Markel, he's like, it's work-life synergy. And that really has made sense to me. Like, I honestly, I like what I do. I don't consider it work, to be honest, which can be very frustrating, I think, for the people around me to do. And I have to be more cognizant of that, because if I was doing it, I would just work, and I would be fine to work all the time. But yeah, I think that the misunderstanding sometimes of horse owners is you're not available on a Saturday because you're out in the mountains, kind of thing. Sometimes that gets a little frustrating, but I think the majority of people really understand over time. And but that's the things that I think are there. And then the other is the horse owners, I think, always want the best for their horse no matter what. And sometimes they are like, it's an emotional kind of scenario, and using those judgments for us to do what we can to do for the horse. Sometimes we have to circle back around and say, let's be practical, let's do this stepwise kind of thing. And I think that's also something that I learned over time having horses, is that being more stepwise and understanding and conservative in terms of what the things I do next are important to understand the disease process fully.
So when you look back at your path you have taken so far, what are you most proud of?
Oh man, that I mean, to be honest, what I'm most proud of is not something about my profession. To be honest, it's my family and friends that are what I've surrounded myself with. Is probably the biggest thing.
To become that person.
Yeah.
Why, next being a veterinarian, being a professor, to stay in the middle with both feet down to earth. Yeah,
exactly. Those are the things that I think I cherish the most. Or one, I don't know that I've always been super kind, but definitely trying to be a good person and surrounding myself with people that help me be that better person.
So, what still excites you about your work today?
Oh man, this field is changing on so fast that I can't keep up with it, to be fair. And I definitely spend time reading. I get up in the early mornings and read new technologies, new things like that. I think is just as we talk about this all the time. Actually, listen to podcasts to be better.
Actually, our days have 2 less hours.
Yes.
There's if there wouldn't be any excitement anymore, it is purely not imaginable.
Oh, for sure. And the cool things that are happening with orthobiologics, technology in terms of imaging ways, artificial intelligence, and how that can make my life a bit easier in terms of my work, and really check even being a better radiologist because of the things that artificial intelligence or machine learning can potentially do. Those are things that really excite me going forward. Am I worried about my job at this time? Not necessarily, but I do think that computers to shape the future are going to be kind of a cool thing for imaging. And just the evolving technology that's out there is, I think, very impressive.
There's a very nice, good quote by a friend of us, Derek Nottenbelt. He was telling already several years ago that technique is not replacing a veterinarian, but it will replace the veterinarians who won't use the technique.
Yes.
So I guess he was right already a few years ago, before common AI.
Yeah.
And what do you hope people understand about about your work and about veterinary medicine after listening to this podcast?
One, hopefully I'm a bit more of a human and approachable person. I think that's probably one of the biggest things for me, is being able to be approached and ask questions. And a lot of times the things that are most meaningful, as we talked about, are explaining your mistakes that you made over time, and that takes, I think, a bit of confidence to understand that you're human. And then the second thing is take back that you're human. So there's, I don't think that owners don't think this, but sometimes it gets lost, is we are also emotional creatures as the veterinarians, the same as the horse owner, and that we have a vested interest in the horse as well. And it's not just because we want to do our work, it's because we want to put the horse first. At least for you, me, my friends, it's about the horse in the end.
So, Kurt, thank you for sharing your story so openly.
Yeah.
In the next episode, we will dive deeper into your clinical work and explore some of the questions horse owners are often afraid to ask.
Yeah, absolutely.
For now, thank you for reminding us that behind every diagnosis and every treatment plan, there's a human story and a lifelong commitment to the horse. If you enjoyed this episode, make sure to join us for the next conversation with Dr. Kurt Selberg, and where we move from the personal journey into the realities of equine medicine today. Thanks.
Thank you.
Danke, dass du dir heute Zeit genommen hast, bei unserem PKN-Podcast dabei zu sein. Wenn dir die Folge gefallen hat und du unsere Arbeit in Zukunft unterstützen möchtest, würden wir uns riesig freuen, wenn du uns auf deiner Lieblings-Streaming-Plattform oder bei YouTube abonnierst, likest, hypst, kommentierst oder Fragen stellst. Damit können wir sicherstellen, dass du zukünftig keine Inhalte verpasst und du hilfst uns und wir erreichen auch noch mehr pferdebegeisterte Menschen in Zukunft. Vielen Dank dafür und bis bald.